A urine collection and also the removal of a catheter. First, I would check the orders, the doctor's orders, and make sure I have the right size catheter, the right type. The catheter size normally for a female is 14 to 16 French. I'll have all my supplies here. I'm going to enter the patient's room, provide for privacy. I'm going to perform hand hygiene. I'm also going to check my patient identifiers to make sure I have the right patient. I'm going to check their allergies, make sure they're not allergic to latex, iodine, tape, or lubricant, and they are good to go there. I'm going to explain to them that today they will be receiving a Foley catheter. This will help with the residual urine and their trouble with voiding. I'm also going to assess their pain level on a pain scale 1 to 10. And I'm also going to assess their abdominal area for any distension that could possibly be going on right now. Next, I'm going to get them ready for the procedure. I want to just kind of expose the patient. It's kind of hard to not expose them when you are inserting a catheter, especially because you have to use a sterile technique. But just try to make them as comfortable as possible. I will have laid down a chucks pad, and I'm going to have them positioned in a lithotomy position. If they aren't able to stay in this position, I will, there's another position that they can be in for a catheter insertion, which would be a sideline position, but they're good with the lithotomy position. I would provide peri-cares as well, and if they would need it, I would check the area to make sure there's no redness, any discharge, drainage, odor, and they're good to go there. Next, I'm going to get my supplies ready. I'm going to provide for hand hygiene again. I'm going to open my package here. Okay, this can be used as a garbage bag. So I will be throwing away quite a few things during this procedure, so I kind of want something that's easily accessible. Just place that right there. Just every time you do a sterile procedure like this, you always have to remember the 1-inch margin rule. So that's kind of what you can work with. These are the sterile gloves. I will be using those in a minute, so I'm going to set those aside. And I'm going to place the drape on them, or by them actually, the sterile drape. So just kind of take it out of the packaging. Just hold it up high, not too low to where it could be contaminated. And I'm going to fold this. I'm just going to try to adjust this as much as I can without contaminating this. And then I will actually fix this in a minute. I'm going to apply my sterile gloves right now. And I will fix the fingers in a minute. Make sure that I get my gloves on in a sterile way before I do anything that could possibly contaminate them. Okay, and then I will adjust. And if you do have a lot of problems with the sterile gloves, just grab a new pair because it's the easiest without contaminating them. So next I want to adjust my box first. So I'm going to pick this up and bring it back. And I'm going to there we go. Okay. And then this is used for a male patient when you are cathing them, so we don't need to use this at this time. Then I'm going to separate the two boxes. This can be brought up. And this I'll just leave back. I'm going to open my iodine. If you get iodine all over your gloves, no big deal. You can go ahead and just fix that by rubbing your hands together to kind of just get it to dry up. And I'm just going to get rid of that. It's my specimen collection container. That can just be set right there because we will be using that in a minute. My lubricant. Get this open. I'm just going to kind of apply some of that in one of the compartments in the container. Next, I'm going to assess my balloon on my catheter to make sure that there's no leakage at all and that this is a good catheter to use. I'm going to just kind of take this out. I'll leave the packaging on there for now. I'm going to take my syringe. Inject some of the saline in there to make sure I get a balloon. I don't know if you can see that on the camera, but it's right there. So there's no leakage. I got the balloon to form just fine, so we're good to go there. Next, I'm going to provide for cares on the patient with the iodine. This hand will become contaminated. I'm just going to pull back on the labia folds and I'm going to clean with the iodine swab. First one's going to be the minora. Bring it back, majora, and bring it back, and the meatus. And just make sure you bring that back without contaminating your sterile field. And I am ready for the catheter insertion. And it probably would have been an easier way just to take this out of the packaging. Smooth as I can without contaminating anything. Okay. I'm going to lubricate 1 to 2 inches and I'm going to start with the insertion, or I'm going to start with the insertion of the catheter. If you feel resistance, kind of just try to twist it just a little bit. See if that'll help with the advancement. Once you see urine, advance it another 1 inch. And then take this hand and pinch it about 1 inch down and inject the saline. Make sure you inject all of it in there. And at this time, just check with your patient, make sure that they're not experiencing any discomfort at all. Okay, and that went in just fine. And then kind of just do a little tug on the catheter to make sure that the placement is in there. And then as you're applying pressure on the syringe, go ahead and remove it. Okay. Now, what I'm going to do before I finish up with the catheter, with putting in place, I'm going to remove my gloves, provide for hand hygiene, and I'm going to take this out of the box. You always want to make sure when you are finishing up with the catheter that the tubing is coiled. That'll help with any stagnation or sedimentation with the urine. And then go ahead and secure it. Side here. That'll kind of just make it a little bit more comfortable as to where it's secured for the patient. And make sure you hook the bag to the bed as well. And monitor the patient, the intake, the output. Provide for peri-cares as well once you're done with this, just so they feel a little bit more comfortable. And then clean up and go ahead and document as to how they tolerated this procedure. So I'm going to just get this out of the way right now. Okay, so it's been a while and the patient's doing well with this. The doctor has ordered a urine sample, a sterile sample. So I'm going to check the orders first. I'm going to make sure I have my right patient, the identifiers, patient identifiers. I'm going to come into the room and provide for, well, before I would have checked the identifiers, I would have provided for privacy. Come into the room, and then I'm going to provide for hand hygiene. Let the patient know that the doctor has ordered for a urine specimen from them. This, you don't really have to expose them too much. Just enough so we can get the specimen and get it in a clean, sterile manner. I'm going to provide for actually put my gloves on after I provided hand hygiene. And then also what you're going to want to do prior to this is you're going to want to clamp the tubing because this will actually help for the urine to build up in the tubing for you to collect it. It should be about a 30-minute clamp, no longer than that. And then I would come back after 30 minutes. I would already have put my gloves on, provided hand hygiene, and put my gloves on. I'm going to get the needle out here. Kind of just set that right there. I'm going to loosen up the cover on this this collection container, and then I'm going to take an alcohol wipe before I collect the specimen, and I'm going to clean the port. Clean it in a circular motion with the alcohol wipe. Okay. I'm going to uncap this. I'm going to insert it at an angle, and I draw up 3 to 5 mils for the collection. Okay, and then sterile technique, I'm going to put it in my container, keeping the cover down and slowly inserting it so it does not splash. Close that, cover my needle. I would make sure initial date and time. This is only good for 15 to 20 minutes, so you do need to get it to the lab prior or before that time frame is up. Otherwise, they will not be able to get a good sample out of it. So after the specimen collection, patient's been doing just fine with the voiding into the catheter bag, and doctor has ordered for them to have the removal done. And this would have already been unclamped prior to the removal. And I'm going to let the patient know. I would come to the room, provide for hand hygiene, I'd put gloves on, I'd check my patient identifiers, and I'd let them know that they're going to have their cath removed today. I would have previously checked the chart to see how much solution was injected into the catheter. It'll be 10 mils, so that's what I'm expecting to take out. I would also have emptied the catheter bag, and I would have put that into a cylinder and measured that as an output measurement. I'm going to loosen the tape here.